How might your social well-being or your mental state influence your knee pain? Part 2 of managing pain when your surgeon says an operation won't help. So we've previously talked about how weight may contribute to knee pain, but maybe this isn't a factor for you. Are there other factors that you can influence? I'm Shelley from Miami Physio and Lakelands Physio, and I want to explain how some other factors may be making your pain worse. So, other known contributors to pain include lifestyle factors such as social well-being and your mental state. What? How does my social life and my mindset contribute to my pain, I hear you ask? So to explain this, I have to nerd out on some pain science here first, so bear with me. So there's some cells in the nervous system called the glial cells. Now these cells make up more than 1/2 the volume of all the central nervous system. We used to think these cells were just packing cells, like those little polystyrene bits that protect your parcels in the post. But actually, now we understand that these cells communicate and influence the nociceptive or the pain receptor cells. So if the glial cells get excited, they actually increase the sensitivity of the pain receptors. That is, they make your pain feel worse. So your 3 out of 10 knee pain might now feel like a 9 out of 10 pain. So what ramps up these glial cells? Stress, mental trauma, anxiety are all good examples. This could be in the form of some bad news, an emotionally traumatic event, or just a stressful day in the home or office. We often notice this with patients when they've been progressing really well and then suddenly their pain is flared up without any physical event, but rather some sort of stressful situation. Or we see a pattern of pain which is not matching physical movements. An example of this is a patient with back pain who can sit for hours whilst doing something they enjoy, but when working in a stressful environment can only sit for 3 minutes before their pain flares up. They've tried all manner of seats at work. Perhaps it isn't the seat, but rather it's the stress ramping up the glial cells and therefore increasing their pain response. Is this sounding familiar to you? Keep watching to learn how to turn down that pain dial. So just as glial can increase pain perception, if you can dial the glial cells down, you can actually regulate your pain perception. So how do you do that? Find the joy. If you can calm your farm and find a way to manage your stress or anxiety, you can switch off those glial cells. How you do this may be different for everyone, but some things that you can try are listed below. So doing an activity that you enjoy. It might be reading, it might be getting outside, meeting with a friend, whatever gives you joy. Breathing exercises such as 4 and 6 breathing. So this is breathing in for 4 seconds, out for 6 seconds, and repeating 10 times can help to reset the nervous system as well. Even just recognizing the trauma or the situation that's contributing to your heightened pain perception and understanding that your underlying pathology is not actually worse can actually decrease those pain receptors and actually turn off the glial cell activation. So if you have pain that doesn't seem to always match a mechanical or a movement pattern, or perhaps your doctor has said surgery won't fix your pain, try working on these pesky glial cells and see if you can decrease your pain response and your pain perception. If you would like some help with this, give us a call at Miami Physio or Lakelands Physio, and we can help you to work out a strategy for helping to manage your pain.